4 days left before you need to have signed up for health insurance as required by the Affordable Care Act. But there are still many questions, lots of confusion, and ample frustration. Here to help is Mike Dillon of Dillon Insurance Services. And Mike, tonight we are letting our viewers on Facebook ask the questions. So thank you for being here. Let's start with Diane White Bailey. She has a really good question. Take a look here. She says, I lost my job last year in my insurance. I have a promise of a job in March that will allow me to sign up for insurance. Do I need to get insurance for a month, or can I? And most insurance companies require a longer commitment. So what does she do, for example?
So two issues. First of all, on the Affordable Care Act requires that you have coverage for at least 9 months to not be subject to the penalty.
Okay.
So she does. I would recommend that she gets coverage for at least a month, and then once she obtains it, she'll have a qualifying event by being offered different coverage, and she'll be able to change, no problem.
So she won't have to pay double?
No, and at the end of the day, I mean, typically, you know, you need to pay your premium for the insurance company to pay you anyway, or to cover you, so. Yeah.
Okay, good information. A lot of concern echoed by many viewers on Facebook. Let's take a look at Carol Cardwell's question. She says, deadline after deadline after deadline, just wait, there will be another new deadline. Is she right? And will we always have to sign up annually for this health insurance?
So probably, yes.
Probably
Everything's always changing with the Affordable Care Act. There's a lot of proposals already out for the 2016 open enrollment. They're looking at shortening it, going from October 1st to December 15th. And then there will be all other kinds of different requirements related to the IRS.
Right.
What has to be transparent through the exchanges. You'll definitely see changes next year. And one of the big ones is the one that you just mentioned was, how are they going to handle those re-enrollments, if they're going to have to do that, or is it automated? And if it is automated, what if the premium's substantially higher? How do you make sure that that's clearly, you know, told to the client? Right,
and it's just so new. And more frustration shared by Nikki Middleton. Yeah, I have a question. Why can't I afford this affordable health care? So are there options for people who say, this is just outrageous? I'm paying more now than I did before the Affordable Care Act.
Yeah, sometimes I've heard it referred to as the Unaffordable Care Act. But so a lot of the things, unfortunately, with the Affordable Care Act, it's, you know, it's a policy that's been passed and regulated, and we're going to just have to, I would recommend you work with an insurance agent who specializes in health insurance, and make sure that, you know, they usually can direct you in the right way, whether that's through the exchange or a private solution, or even with the employers. There's innovative products out there.
Okay, that works best for you and your family. Great, and you are one of them. If you still have questions for Mike, he'll be here until 6 tonight, 858-2222.